what am I interested in? What am I going to do? What is the future of health? What is out there? And so I had to find my interest. And so before I left, 2 years before I left, I started to looking at, if there's so many things that are frustrating about medicine, what is the future of health? It's a question I ask myself every day, even today. What is the future of health within a specific context? What really is the future of solving that problem within health? And so I started to go to conferences. And here I will say, make no mistake of how grateful I am for my privilege, how much I know that not everyone can get up and walk out and change their lives. When I was leaving, some of the saddest moments where nurses who had, used their income to do extra courses to try and, just progress in their careers, and yet the NHS roles were just not helping them get anywhere. And they just looked at me and they were like, yeah, it's not fair. You don't understand. I would love to transition. I would love to go out into the world, but I don't have any options. I don't. And that thinking of not having options is really not very good for medics, because we have to think out of the box. We have to find our interests. Yes, there is medicine that's helping, but once you've been in a hospital setting and you've looked after patients and you've run logistics and you're part of a team and you've done pathways, there are lots of things we can do out in the world. And so I started looking, what is the future of health? How can I solve all the little frustrating things that annoy me? How can we solve this problem? So I started going to conferences, but I had already done fellowships outside of the UK. A lot of my career, when I look back, led up to this moment, because I went to France for 6 months at ST7. I say I didn't CCT. I was like ST12 when I left. I'd done so much. I was past CCT and way more qualified, than a lot of, people in my training program who had actually CCT, because I kept doing stuff. I went to France for 6 months at ST7. I would go, when I wasn't satisfied with my surgical training, I would go to Germany and do courses. I'd spend all my money investing back in my career. And so I went to conferences around the world, Silicon Valley. I remember I got a boyfriend at the time and begged him to pay for me to go for this conference. I mean, literally people helped me. It's privilege, I couldn't afford it. Someone actually funded me to go to that conference. And it was like exponential medicine. What is the